surgery would be a failure. And the only reason I would get an MRI is for surgery, right? I'm talking about my neck. That's been bothering me. I guess I have a disc herniation every now and then. It flares up. Maybe my posture is bad, using too much time on the phone, blah, blah, blah. Slept poorly. And then my left hand gets weak and hurts when I grip things. And then I work on improving it. But I feel like, maybe I should just give up and just get the MRI, get the surgery. Except surgery is basically a failure. Surgery doesn't fix the issue. Surgery causes a lot of problems itself. You're cutting somebody open, disturbing their normal anatomy, touching nerves that should not be touched by metal objects. Surgery would be a failure. And I pushed myself to do more. And now I'm better again. And I need to work at it to keep on being better. And the thing is, thinking about the idea of surgery as being a failure is actually sort of counterintuitive, or rather not commonplace. Many people think, wow, surgery, you could fix it, right? Back surgery, we talk about people getting all the time. You try to avoid it, but eventually you need it, right? I mean, those injections just aren't the same. I mean, PT only goes so far. But if you think of it as a failure, do you want to be a failure? Do you want to give up? It seems like it's the easy way out, and I've used it before, right, for treating my sty, which you could just treat with hot compresses and rubbing it frequently. It'll dissolve that stuff and it'll start draining out. But I got them to cut it open and drain it out that way. Said I was too busy. That's low risk. Spine surgery, back surgery is not. Some people come out worse off. You could potentially be paralyzed. Wouldn't that be horrendous? When they do spine surgery, oftentimes they do an anterior approach, means they come from the front to your spine. You can imagine there's a lot of stuff in the way. A lot of stuff could go wrong. But thinking about surgery as a failure, as you give up, as in you're done with life, that motivated me to try harder, to not give up. And I think having options is a good thing and yet a bad thing, right? Because when you give people options, they're like, oh yeah, that's fine, right? Like if you were trying to make it to the last restaurant that was open, you would try really, really hard to finish that bike ride on time so you can make it to get food, hot food for the night. But if you know there's options, I mean, you really want to get this nice restaurant, but that's fine, there's always fast food available, then you're not going to try as hard. When I was in New Zealand, there was one place open and one place only, and I didn't make it. I didn't realize that. And when you say there's options, theoretically there might be fast food. There might be McDonald's. It's half an hour drive away, and who knows if it's actually open. They don't. Options are not always a good thing. Surgery is usually an option. The surgeon usually does operate to help people, but it's not a good thing when they operate on you. It's not an equal option. It's a bad alternative. Right? It's like you have an infection in your leg. Yeah, take care of it or you might have to chop it off. I mean, most people understand those aren't really quite the same options. One's a good thing, one's not a good thing. When you say an option, it's like saying you have the option of eating or you have the option of not eating. Well, I mean, that sort of makes sense. Like telling the kid, you eat now or you don't eat anything. I mean, it's an option. But you would not choose that option if you had half a brain, right? Surgery. Not a good choice. Not really a good option. Not something you want for your spine.